Sorry, folks. Just getting back to the beginning here. Actually, let me. Sorry about that. All right. Okay. Well, welcome everybody today. Thank you so much for joining us on this town hall that the Workforce Development Committee is hosting on promising practices for CHW employers. And we are going to dive right into our webinar for today. So I will move to the next section here, and I will actually turn it over to Tasha to lead us through the first several slides.
Good morning, afternoon. I'm here in Texas, so good afternoon, everybody, and welcome. We are so excited that you are here with us with the Workforce Development Team Committee. Please drop in the chat where you are from and what you do. We'd love to know where you're from. We're going to get started with our opening, then we're going to do an icebreaker. We will overview the promising practices that the Workforce Development Committee has worked so hard in getting together. And then we will engage. We will break out into 2 different breakout sessions. The first one, we will have some discussion, and then we will come back for a second one. And we will report back all that you have discussed in your breakout room, and then we will have our closing. It's great to see some people from California, Delaware, Alabama. Keep putting in the chat where you're from. Next slide, please. So these are our learning objectives for today. You will be able to name at least one promising practice you would like to adopt within your organization. Name a potential benefit of implementing the promising practice within your organization. Consider your organization's readiness to apply the promising practice, and identify approaches for how the promising practice would be implemented and sustained. A little bit about NACHW. NACHW was founded in 2019 after several years of planning and organizing by CHWs and allies across the U.S. Our vision is that CHWs united nationally to support communities in achieving health, equity, and social justice. We have the 5 A's, what I call them. We do this through amplifying, articulating, being an ally, advancing and advocating and activating the CHW workforce field. We have a deep commitment to the workforce development pillar. NACHW strategic plan, we planned this back in 2022. And the first priority is training, professional development, and workforce development. And from that, our goal is to provide a clear and actionable guidelines for employers to better support their CHW's professional development. This is what this committee spends time every month doing, is getting together these priorities and strategies for professional development, and also building a training and technical assistant repository to easily access training on various topics in CHW core competencies. That's something to come very soon, but something that the Workforce Development Committee has been working very hard on is getting together these strategies that employers and organizations can implement into their organizations to help their CHWs be successful in their careers and in the work that they're doing to make impact. The Workforce Development Committee is made up of the NACHW board members, staff, and members to advance these objectives. It's open to anyone. We have a certain time that we open up those applications. So if that's something you're interested in, stay tuned to learn more. And I will pass it. Oh, we've got one more. And NACHW's committees, we have the Workforce Development Committee, but we also have additional committees like the Development Committee, Policy, the Executive Committee, Nominations Committee. We have Unity coming up. So the Nominations Committee takes care of all of that. And our Ambassador Committee, where we have ambassadors in different states that spread the word about NACHW and the CHW workforce field. And so you can learn more on our website if these committees are something that interests you. Now I will pass it on to my colleague, Kim.
Hello, everyone. My name is Kim J. I'm with the NACHW Workforce Development Committee as a co-chair, and I just really want to welcome you guys here this afternoon. You heard Tasha talk about the wonderful committees, and I just wanted to reiterate how it's a collaborative effort between the CHWs and the CHW allies who support this great work, and always being inclusive of having all voices be present at the table. And if you look at this lovely, lovely picture here, you see that we are a diverse workforce with combinations of allies and CHWs to make sure that the things we talk about within the committees are inclusive and make sure that we are being equitable in how we approach our work. Next slide, please. So, as a way of getting to know a little bit about you, we would love you to participate in a bit of a Mentimeter with us. And the questions that we want to ponder are number one, what do you look forward to most about spring? And the other question is, what does spring look like where you live? So, if you are Mentimeter savvy, the link has been dropped in the chat. And if you go into mentimeter.com, you will be led right to the survey. So go ahead and click the link and join. It is anonymous, so we'll be able to see everybody, but won't know who said what. So we got something coming in so far. Baseball games. Ooh, longer days. I second that. What are some other things? Track meets. Things blossoming. Nice. And as I look at the responses populate, it reminds me that we really like a lot of the same things, regardless of where we live. We are looking forward to some amazing things. So, warmer weather, the flowers blooming. Because I'm in the Midwest, I'm hoping for no snow either. That is a part of our spring regiment. We could have a full 3 seasons in one day, but I'm looking forward to that as well. Alrighty. As we finish up adding those comments, the next question is, where does it look like? What does spring look like where you live? Interesting to see that response. As I said, in Chicago, in the Midwest, it could look like snow, summer, and spring in one day. So right now, spring looks sunny, sun and shiny. Sunflowers blooming, sun kissed, a lot of pollen, cool air, pink flowers. So because I'm challenged with allergies, I don't want the pollen. But we see a lot of pollen, clear skies. I love the cherry blossoms. I'm looking forward to one day seeing those in live and in living color. All right. So thank you for everyone dropping your responses regarding where does it look like where you live. And so we'll go on and continue with our conversation. So as we continue to talk about why we're here today, I just wanted to speak about the focus of the promising practice. And you guys are probably saying, what is promising practices? Well, we wanted to take a different spin on like best practices because again, things could look different wherever we are in our state, but promising practices is really for CHW's employers who really want to improve their workplace satisfaction and the retention of their CHWs and the services that they provide. It really is a space or a start off point where employers can implement some of the promising practices of CHW integration into their systems. All of us may have ideas about what that looks like, but some of us may not have any idea about what that looks like and how to be effective in that space. So the promising practices serves as a guide or blueprint of sorts to get you ready for this great work and how you can effectively have CHWs be a part of your teams and how to navigate that space with clear vision. Okay. As we move forward, we wanted to give some definitions of some of the things you may see in those promising practices. And really, it is adopting the community health worker definition, which is from the 2009 APHA definition, which some high points is about someone who is connected to community, has deep roots in community as the defining definition. And when it comes to how they are trained, it is attached to the C3 best practices for training community health workers and those core competencies. And the links are attached to those to give you further definition of these two bullets up front. And then we talk about CHW employer, and the definition that we see when we're talking about that is an organization that hires or contracts with community health workers. CHWs are employed by many types of organizations, including community-based healthcare, public health, schools, social services, and other agencies. And we wanted to say that the promising practices really is a CHW informed activity or approach or concept that has been implementing to varying degrees in programs and communities. A promising practice has the potential to positively impact the community health worker, as well as the organizations and the communities that they serve. So as you go through the two-pager, you will see these come up as items, and we want you to know what perspective that we are thinking of when we speak to those on those promising practices. So we want to talk about how did this come about? Well, the Workforce Committee really identified some of the 5 most popular topics that came from the feedback from NACHW board members through our 2024 Town Hall. And what I like about this process is that it is very inclusive. Again, we want to hear the perspectives because we may have ideas about how things work, but we want to make sure that it is effective for all those who are a part of NACHW and how they implement their community health worker programs and how they are trained. So we used a very iterative process. It really was informal to create some practices for each topic. I tell you, we went over and over this to make sure that we got the language right, that we had the thoughts of different areas included in what this would look like, and we refined it. We looked at it again with a fine-tooth comb, and everybody drew from their experiences from working as researchers, as trainers, as supervisors to make sure that this content was relevant. And now we came up with a product that we feel comfortable sharing with our colleagues, our allies, our CHW employers to make sure that we are capturing the thoughts effectively and making sure that what we are sharing today is not missing some key elements. And that is why you are here, to make sure we are capturing all that appropriately. And we want to make sure that even those thoughts that we included on those promising practices can be something you can even incorporate and implement right away. That is our desire.
Great. Thanks so much, Kim, for taking us through just a level setting there and getting started, both for the Workforce Committee as well as the promising practices. I'm Ben Hummel. I'm one of the other co-chairs for the Workforce Committee, and I'll be providing a little bit more of an overview at this point of the PDF that we're sharing today. So when we were compiling the practices for each of the 5 areas, we recognized that there were several practices that really cut across all of the 5 domains. So we decided that in order to try to reduce redundancy overall, we would label these as cross-cutting practices, and they're listed on this slide separately, but again, with the idea that they would really inform any of the topic areas that we'll be covering today as part of the breakouts. And so these would be clearly defining, again, the CHW's role in alignment with the roles and skills that are proposed by the CHW Core Consensus Council, creating systems to evaluate CHW programs and collect data on their effectiveness, including on training programs, and to ensure that employment practices prioritize the lived experience within communities that are being served. I encourage folks to keep in mind these cross-cutting, overarching practices once we go into the discussion sections as well. I'm going to move to the next slide. So the first deliverable, again, that NACHW was created to showcase the promising practices is this 2-page PDF, which is now available for download on the NACHW webpage. I'll actually ask if one of my colleagues wouldn't mind maybe just putting the link in the chat so people can open this on their own screen. I'm not going to go through all of the practices at this point section by section because we'll actually be covering those in the breakout rooms. But what you'll see in the document, big picture, again, is that the practices are divided into the 5 different areas, and those have to do with CHW training, employer readiness, supervision, integration within healthcare teams, and career advancement. And for each of those areas, there'll be their own set of corresponding practices. There's usually about 4 or 5 in each area. The citation links for each practice are embedded within the 2-pager. You can see those using the magnifying glass icon that appears in it. They're also written out as in-text citations in the slide decks that we'll be reviewing with you today. And I want to acknowledge again that at this point in time, the practices, these are high-level statements at this stage, which Workforce will be looking to develop further in the coming months or over the course of 2025. But the first step in that process is gathering input from all of you today during the course of this town hall. And our end goal here would be to create additional resources that go further with the practices and provide information and key strategies related to how these would be implemented within organizations. So more to come moving forward, but we're excited to share these with all of you today. So we're now going to transition into the next portion of the call, which is our kind of member engagement section, where we're looking to review and discuss the practices in smaller groups. So we're going to do a series of breakout sessions. We're going to do 2 rounds of 20-minute breakouts, and there will be 5 rooms, and within each room, they will cover one of the topics from the promising practices. So you'll see here again on this slide, the first room would be, is going to be assigned to cover CHW training that will be led by Kim and Tasha. The next room will be CHW employer readiness, which will be led by Antoinette and Yanel. In our third room, we'll be covering CHW supervision with Stephanie and Treva. In the fourth room, we'll have CHW integration into healthcare teams, and I will be covering that with Melinda. And then in our final room, we'll be focused on CHW career advancement, and Emily and Anna will be taking on that topic. So folks will self-select which room they want to participate in based on your interest. Note that we're only doing 2 rounds of breakouts, so you will not, unfortunately, be able today to do a discussion around all 5 areas. So we'd encourage you to think about, of these 5, which are the 2 that are most of interest to you. But once you join the breakouts, the moderators will review with you what the practices are for that area or for that domain. They'll be sharing those with you. And then they'll facilitate a discussion using a set of questions that you see here on this slide. So we'll be asking you things like maybe what is not clearly understood or what might need more clarification from the practices. What are you confident that you would be able to apply within your organization? Why or why not? What type of information or resources might you be looking for related to implementation? And what else might be missing from the list of practices that you think that we should know? And then as the moderators facilitate discussion around these areas based on the practices, they will be taking notes on the discussion. We'll then be doing a second round using the same process. And then at the end, we'll be coming back together and have the moderators share back with the full group some key highlights from their room over the course of the 2 rounds of discussion that they had in that space. I also want to note that it may not be possible for you to get to all 4 questions or all of the practices in your topic during the course of the 20 minutes, and that's acceptable. That's fine. We want people to have plenty of time to take this in whatever directions are most of interest to you. So don't get bent out of shape having to move through all of these areas. We encourage people to kind of move with the discussion where it takes you during the course of that time together. So I will just quickly take a look at the clock here. So we are about at 3:22. So I'd say, Aurora, let's open up the breakout rooms so now people can start to join those spaces. And I'd say, let's say we should end that round. I'll give it just a few minutes extra. So let's say at 3:45, I would say we can come back to the main room, and then we'll do kind of a switch up and transition into a second round of discussion. So great. So I'll pause here and let Aurora open up those rooms on your end. And I am looking forward to engaging with some of you in the breakout space.
Thank you, Ben. The breakout room should now be open. Hopefully folks are getting a pop-up at the bottom of their screen, allowing them to select their breakout room. If you're not seeing that pop-up or you're having any trouble, feel free to pop in the chat or come off mute, and I can also assign you to whichever room you like.
Okay, I don't see it yet, Patricia.
Okay, let's see. Do you know which room you would like to join?
Doesn't matter, they're all interesting.
Okay, excellent answer. Okay, you should now get a request to join a room.
Aurora, I'm going to ask you to place me because I'm not seeing my option to join.
Yes,
Not
absolutely.
either.
Are you with room
I'm not
5, Kim
either.
J?
1.
1. Okay, absolutely. Okay, just sent you that invitation.
Thank you.
This is
Absolutely.
Meta Williams. Could you assign me to room 1 as well?
Absolutely.
Thank
There
you.
you are.
And Aurora, I'm open. So whichever
Okay.
room is fine.
So I just went ahead and sent you an invite, Sierra. Hopefully that'll pop up.
I'm not getting the pop
I
up.
need to go to room 3, please, Aurora. I'm sorry, I'm not getting a pop-up either.
Absolutely.
There we go.
Rebecca, I also heard you come off mute. Do you know which room you would like to join?
I'm not picky.
Okay. Fantastic. Okay, I just sent you a request to join a room.
Hey, Aurora, any room will do for me.
Awesome. Okay, give me one moment. Just sent you a request. And hello, I see someone just joined us. We actually just sent folks off to breakout rooms to discuss our new sort of promising practices and sort of network and get to know folks. Hopefully you'll see some breakout options at the bottom of your screen. If not, I can also assign you to a breakout room. Hi, Maria. We are actually, folks are in breakout rooms right now. They have about 5 more minutes to go.
Okay,
I
I'm
don't know.
sorry. I just tried to get out of a meeting as soon as I could.
No, no worries at all. I don't know if you can see the breakout room options. Hopefully you can. If not, I can let you know which ones there are and help you choose one.
Is this on the chat section or let's see?
No, here,
I don't see
we
it on that.
have CHW training, CHW employer readiness,
Yeah, I'm not
CHW
seeing any of that.
supervision. Okay, got it. CHW integration into healthcare teams, CHW career advancement. Are any of those interesting to you?
The health one.
Yeah, absolutely. I will assign you there. And we're also doing 2 rounds, so you'll have
Okay,
another chance to
sure.
do one for the full time. Okay,
Thank
you
you.
should get
I
a
got it.
request soon.
I got
Okay,
it.
perfect.
Thanks. Bye-bye.
Okay. Hi, folks. Thanks for headed back. We will wait another minute or so for folks to join us, and then our facilitators will explain changing breakout rooms around.
Okay.
All right, well, welcome back, everyone. Some of you might have already transitioned back prior to this, but I hope the first round of breakout rooms went well in terms of your discussions. And at this point, we are going to try to do yet another round for about another 20-minute window. So folks, I'll have Aurora open the rooms once again. And I would encourage you all to think about choosing a different topic area that you would like to discuss. And in terms of when we'd like to come back as a full group, let's say, we'll probably say right around 4:05, or I guess 4:06, Aurora, we can say to reconvene. So, great.
Absolutely. Give me just 1 second while we fix up the settings. Sometimes Zoom can be tricky.
And actually, you know what? I might revise what I said and just say 4:10, just to make it easier. I think we'll still have plenty of time with 20 minutes left in the call after that. So,
Excellent. Thank you for your patience. Here we go. Okay, that's another 22 minutes. And we are opening the rooms. Once again, hopefully folks are getting pop-ups at the bottom of their screen saying the breakout rooms are once again open. And once again, happy to help folks jump into the room they would like.
and if moderators have any questions about which room you're going back into, just let me know. And it looks like everyone is figuring out their sessions. So we will see you in there.
Excellent.
I'm still here. Nothing popped up.
Yes, which room would you like to pop into?
I'm open, kind of like last time. I was in
Okay.
career advancement before.
Okay, excellent. I'll send you an invitation. Let's see. Jessica, do you want any help hopping into a breakout room?
Breakout rooms are closing shortly, and we will get started again in this space as we continue our conversation in Town Hall today. Thank you so much for joining. I hope you had a great conversation in your breakout room. Welcome back. Welcome back. Breakout rooms are closing. People are coming back into the main room. We're going to continue our conversation shortly. Thank you so much for joining. Hope you had a good conversation in your breakout room. Back to you, Ben.
Great. Well, thank you everybody for sticking with us and going through 2 different rounds of breakouts here. So, we have about 20 minutes left, and we'd like to take some time to do maybe some quick report outs from the different rooms, giving moderators an opportunity just to share some of the highlights and takeaways maybe from you on what you were hearing in your session. So I'm going to just go in order here. So would either Kim or Tasha be willing to maybe do just a quick report out, just a couple minutes here, to see if there's highlights you'd like to bring back to the full group?
That would be Tasha.
All right, I'll turn it over to Tasha if you're willing to do it.
That was you, Kim. So our training, a breakout room, we had a really good discussion, especially when it came to the topic of training and CHWs moving along in their careers, and how important it is to have diverse modalities, different ways that people can learn, because everyone can't go in person now. So having different ways, whether it's hybrid, in person, virtual, online, being evidence-based, ensuring that there are clear articles that show best practice or promising practices, that the literature that they are pulling this information from has been tried and true. Also, some good conversation came up about some of the barriers to trusting organizations that train. So sometimes you're looking for organizations to train, but there can be some barriers to those organizations. There can be some barriers and trust issues with trusting organizations to come and train your team. So we discussed the Workforce Development Committee is currently working on the training repository so that people can have a source that is vetted for potential trainings that they may need to bring in to train some of their CHWs. So yeah, we had a lot of good conversation. Kim, is there anything you'd like to add?
Yeah, one thing came up organically, and it's really about talking about CHWs in the same language, meaning that we want to call ourselves CHWs, but with a specificity in a specific area of expertise. So we could be the CHW with expertise in diabetes prevention, a CHW with expertise in facilitation and training, but learning how to talk about us in the common language, which is seen as a positive when it comes to CHW and credentialing and reimbursement, because that is something that really prevents those things from moving forward, because we don't see ourselves as CHWs because our titles may differ from organization to organization. But we wanted to remind everyone that is a CHW or a CHW employer that it can be titled CHW with the specificity in that area of expertise. That's the only thing we wanted to add. Tasha, you did a great job. And thank you for everybody who joined our sessions.
Great. Well, thank you so much, Kim and Tasha, for bringing all of those highlights back. Let's go to the next group now. So I believe Yanel had to jump off the call, but Antoinette or Dr. Francis Shear, would you be willing to share with the group maybe a few highlights from your group?
Yes, and it was in both rounds very interesting as usual. We both got the hot and the cold of it because we had North Dakota in one group at telling us about the minus temperatures and gleefully at 30 something degrees in the spring, God bless her. And we went on the other end to in the other room, so we had South Carolina as well, but we also had California, which was the heat, as we would say, and Vermont, some of the chilly and the cool weather. So that as normal, we did that CHW breadth of experience. And when we're talking about employer readiness, one of the main things that seemed to resonate in both breakout rooms was the definition of the CHW role definition within the organization, whether it was community based or clinical based. Some employers still do not exactly know what CHWs do or who CHWs are, and some communities are not clear on what a CHW can do for them. So that CHW role definition was key. We also wanted, we would, what came up was that the collaboration or the collaborative framework for CHWs to operate in when employed, that needed to be sort of elevated, but also highlighted and sort of identified from the get-go, because the CHW's role in helping, say, the social worker, they what they do with social work, the CHW's role in the care team, in Vermont, we were hearing in Vermont, they're able to shadow some of like the chaplains and some other professionals to do hospice care as well as general health, working on some of the other social determinants of health. So building that collaborative framework, and not just the framework in the care team, but perhaps building a collaborative framework among employers that hire CHWs. That was just some thought that we had coming at the end of the last thing. And last but not least, a very good point that Lupe from California brought up is that we need to remember that the landscape for healthcare and how the public views the health system has changed. And so we now have to, in an employer readiness, we have to also be sure that the CHW position in this changing landscape and perception is aligned properly.
Yeah, great points, Antoinette, and really interesting, intriguing thoughts there, especially around that last piece of how CHWs are positioned with the changing landscape of how communities and patients think about the healthcare system and organizations. It's great. Let's transition over to the third group now, just to make sure we're staying on time here. So that would be Stephanie and Treva. Would one of you want to help report out?
Yes, I can. And so some of the things that we talked about in our room, or the highlights from our room, we would love to see tools and reference material on hiring CHW supervisors with lived experience. A lot of times there's a tension of educational experience and lived experience, and promoting the value of lived experience. But how do we arm CHW supervisors to be able to advocate for that with HR? Integration templates with step-by-step instructions would be really helpful if we could just rinse and reuse and have something that we can just follow, like a checklist, to be able to see good tools for integration. Training and workshops for supporting implementation. So if you're in that process, we would convene a space where we can continue to support individuals that need that level of support with implementation. One great question that came up is, how do you measure lived experience? Which is an amazing question, and I don't think there's like one answer or one size fits all. It really depends in a lot of different ways, but the workforce development team may be assisting with some tools to be able to assist with measuring lived experience so it can be more quantifiable. And then we had a great discussion about convening a space for CHW supervisors to share tools. So while we can have like a kind of free form agenda, it is a space. We've got some kind of facilitated questions to ask, but it really is a space for CHW supervisors to bring their tools, bring their documents, bring their resources that they already have and share what they have and gain from others who are in that space as well. So the document wouldn't be proprietary information. It would be a very generic document that you're bringing that you can just share with others. So then they don't have to start from a blank piece of paper with workflows. How do you do one-on-one, right? Like having those documents and tools available to be supported as a CHW supervisor would be really helpful, because oftentimes one person leaves a position, there's no succession plan, or, there's a lot of institutional knowledge that may leave with that person on how things were done for smooth workflows. And we would love to be able to share that with one another, convening a space for organizations to connect so that CHW supervisors can share resources.
Excellent. Thanks so much, Stephanie.
Just one more thing that came up in that
go for it.
in our group had to do with quality and consistency of documentation. So that's another piece that came out. But excellent job. Thank you, Steph, and thanks for everyone who showed up in our room.
Yeah, no, I think all really great points and great synopsis for a lot of different topics and areas. I'll dive in here into the breakout that I was a part of. I believe Melinda's having to kind of transition off the call here, but we were focused on CHW integration into healthcare teams. I think it was really interesting to hear that a lot of the folks that joined our calls felt like they had a fair amount of experience around the practices. Many of them were putting many of them in place in terms of integrating CHWs into care teams. What we did hear, though, is it did seem like EHRs, electronic medical records and health records, is an area where there's still kind of a lot of work going on. And, I think something we also heard from people related to EMRs and EHRs, as well as some of the other practices, is it would also be helpful to see maybe some examples or case studies from other parts of the country in terms of what people have tried, what they're doing. It seems like there was a real interest in looking for innovative new practices and ideas. Even if someone maybe has some experience with a particular practice, they might be looking to see how a different organization has maybe approached it differently. Also, definitely some discussion too around impact and how EHRs, EMRs are used to demonstrate the impact that CHWs have, and how do you also capture all of the things that CHWs do within the care team and supporting patients when really it's a role that's super nuanced, and there's a lot of kind of background work, legwork that goes into the role, right, in terms of supporting patients that isn't always easy to document within electronic medical record or within data systems in general. I'm just going to quickly scan here and see if there's any other notes, but those were a few of the things that were standing out to me. And if there are others in our group that participated in any of my sessions that want to add anything there, feel free. But we have probably just 7 minutes left, so I think we should maybe quickly transition here to room 5, which is CHW Career Advancement. I believe that was Emily and Anna. So if Emily, you'd be able to share, that would be great.
Yeah, absolutely. Thanks, Ben. As everyone has been talking, I've definitely heard some common threads that I think that later on we'll be able to pull together. So I really appreciate everyone's contributions today. I had 2 amazing groups talking about CHW career advancement, and I had many CHWs attend both of our my breakout sessions. And one thing that I'm really taking away from it is how can CHWs further advocate for the workforce when it comes to employers? And CHWs have unique needs. And so whether it's access to training during work hours, making sure there's a career ladder, that's something that we talked about as one of our bullets, but making sure that your career ladder actually matches your practice. So if you have the example that we talked about that Devin brought up was, you have a trainee CHW on your career pathway, but you require a CHW to be certified to be hired. So the two aren't matching. So how do we make sure that employers understand that even the value of lived experience? How do we make sure that that is quantified? And it was interesting hearing other groups talk about, like, how do we measure that? But another thing that came up certainly is looking at those requirements and thinking about lived experience versus education, but also creating relationships with state agencies to create positions for CHWs. It seems like that career progression and compensation might not be attached to the work that's being done. So how do we make sure that CHWs are valued and set those standards for our CHWs, and make sure too that training actually could count towards either experience and or credit education moving forward, whether it's an apprenticeship program, a training program, or something else. So, and feel free, anyone that attended, if I missed anything, feel free to add anything in.
Thank you, Emily, so much. Great recap. Yeah, I just want to thank everybody that, to all the moderators, especially who really helped stand up these sessions and get the discussion going today, as well as all the participants that participated in both rounds and have stayed on. So I think at this point we have just about 4 minutes left, so we should probably kind of move to our closing and cap off the meeting. But so I will share screens again. Oh, sorry. So we'd like now to talk a little bit about what next steps look like for the Workforce Committee. And Kim, were you going to take this one? Are you open to this, or do you want me to take this?
Whatever feels good, Ben.
Okay. Maybe I'll roll with it here.
Go ahead.
So as our next steps, I think we've noted this before, but we like to try to develop a more in-depth toolkit for CHW employers related to the promising practices, incorporating a lot of the ideas and feedback that we received today. We have a goal of maybe trying to get this toolkit developed to present at Unity Conference this year. So we will be working towards that. If not, it would be released probably later in 2025. And we will be updating NACHW members about that once it gets posted to our web page and it's in a finalized form. As Tasha talked about earlier, we're also doing some work updating the training repository on NACHW's webpage. So we are also expecting that later in 2025, we'll have more updates to share about that as well when a revamped version of that goes live. I'll also say we've been exploring new partnerships with the Common Health Coalition, which is an exciting area too. And there might be opportunities for us to also showcase some of this work through that network as well. So those are some of our next steps. And I will turn it over to Tasha just to do a couple final slides here just about partnering with NACHW in general.
Yes, so we would love for you to partner with us. We are proud to partner with many different organizations. And so when you reach out to partner with us, we'd like to meet with you, kind of learn what you're looking for. So we look forward to partnering with organizations. And so that can include inviting us to speak at an event. We can partner through sponsorships. We have our annual conference coming up, which is Unity 2025. That's going to be July 30th through August the 1st. So we invite you to come out. We also have policy review for different states that have different things going on, and you would like for us to look over some of that paperwork. Our policy committee does a great job with that. So next slide. And these are all of the ways that you can connect with us. And so we hope that you reach out, and we hope that this webinar has been beneficial for you. I personally just want to give a shout out to the Workforce Development Committee. They put in a lot of work with getting this two-pager together and the information. They spent a couple of months getting this information together. So huge shout out to you guys. And I hope that everyone enjoyed the webinar. And I believe we also have a survey that is in the chat to let us know what you got out of this webinar. And please give us your feedback. Thank you very much.
Great. Thank you, everybody. We appreciate you participating today.